Hello, I'm Nathan Fielder and I'm doing case study 6. And today we'll be looking over infection control in hospitals, and we'll be looking over the history and recent infections and how they have shaped our modern protocols that we follow in order to prevent infection spread throughout hospitals, as well as sterile cleaning practices. And so, firstly, on the history, we have Florence Nightingale's observations and what she noticed during the mid 1800s during the Crimean War in the hospitals was very high death rates. And so she suspected that the long hospital corridors and open windows actually allowed airborne pathogens to spread throughout these large hospital wings. And so she advocated for patient isolation, proper ventilation, as well as better sanitary conditions in these hospitals. And this had a large impact as it inspired the Johns Hopkins Medical Center layout in the 1880s. It's also led to separate patient rooms and better airflow control. The modern equivalent is that all hospital rooms now have HEPA filters to trap and prevent airborne microbes from spreading throughout the hospital into other patients, as well as private and or semi-private rooms to reduce direct disease transmission, and easily cleanable surfaces to prevent pathogen buildup around patients. And so now we have the Toronto General Hospital outbreak in 2004 and 2006, where 36 cases of Pseudomonas aeruginosa were found in the ICU and transplant wards. Over a third of those patients died within 3 months due to severe infections. And the source was found to be 26 sink drains throughout the hospital had this bacterial buildup on it. And this was an issue because the deep sinks and long gooseneck faucets that were designed to prevent hand or instrument contamination were causing water splash contamination, which was then spreading the bacterial growth off the drain onto nearby medical supplies, patient bedding, and work services over a meter away. And in the image, we can see that very clearly as all these little bright blue dots are pretty far away from the sink, but if there was a pathogen buildup on that drain, those water droplets would be containing that possible pathogen, which could then be transferred over the hospital, making patients sick. So, to fix this issue, there were new sterilization attempts installed, as well as new faucets, which were designed to reduce the splashing and lowered water pressure. And then physical sink barriers were installed to catch any sort of residual splash or water contamination that could have occurred. And medical supplies were then moved to over a meter away from the sinks. And the outcome of this was that no additional cases were found after these modifications were brought into place. And then we have the University of Pennsylvania Medical Center and the fungal outbreak that they had in 2014 and 15, where 3 transplant patients died from mucormycosis, which is a severe fungal infection. And so those infected were solid organ transplant recipients who were on high immunosuppressants, which made them incredibly vulnerable to infection. And during their investigation, what they found was that all of the patients stayed in the same negative pressure rooms in the CT ICU for 14 to 58 days. And this was an issue because the negative pressure rooms actually trapped airborne pathogens inside the rooms and were concentrating the mold spores that were found. And because of this, in the nearby carpeted hallways and heavy foot traffic, it was suspected of aerosolizing the mold that was then found on the carpet and wall panels. There was also mold found within the modular toilets of these patients' rooms. And so, due to this negative air pressure, it was concentrating the mold spores into the air. And so the CDC did an investigation on this, and their findings were to stop using negative pressure rooms for transplant patients unless absolutely necessary, as it traps all the air inside the room. They also advocated for reduced foot traffic near the ICU, converting any sort of adjacent doors into emergency exit only to reduce the amount of people walking nearby. They also removed any carpets in the hallways and waiting areas near the transplant ward to prevent any sort of mold buildup or bacterial buildup in the carpet. And then routine moisture and mold checks were then in place to try and fix leaks quickly so that it can prevent fungal growth to avoid these sort of infections. And the results were that the changes implemented, they found no new fungal infections occurred after reopening the transplant program. And this essentially highlighted risks that can occur when you have poor ventilation um, and construction of dust and hospital designs um, that are detrimental when it comes to spreading infection throughout the hospitals.